Good afternoon, everybody. Okay. I do expect that there are going to be a few more folks joining us, but let me introduce myself. I'm Jennifer Clark, the Manager of Programs and Operations with the New York State Coalition Against Domestic Violence. And please let me welcome you to today's webinar on domestic violence in New York State, presented by Director of Public Policy and Advocacy, Joan Gerhardt. Please feel free to take a moment to introduce yourself in the chat box. You'll also find a link to the presentation slides for today. Just so you are also aware, we do have closed captioning enabled for today's webinar. You should have a View Captions button in your toolbar. We are also recording today's webinar, and a link to that recording, as well as a link to the presentation slides and additional materials, will be sent to you in a follow-up email. If you have any questions or comments throughout today's webinar, please feel free to put them in the chat box, as staff will be monitoring, and we will have time for it at the end of today's session. And with that, I will hand things over to Joan Gerhardt.
Well, thank you, Jen. Thank you so much. Thank you for your assistance in facilitating today's webinar. My name again is Joan Gerhardt. I am the Director of Public Policy and Advocacy at the New York State Coalition Against Domestic Violence. And I'd like to welcome you to today's webinar to talk about domestic violence, both what we're seeing nationally as well as in New York State. And I'd also like to welcome Brittany Galati, our Public Policy Coordinator, who's going to be assisting us checking the chat and making sure I don't fail to answer any questions you might have. So with that, let's get going. I'm hoping that we won't keep you for a full hour today, but of course, if your questions require that, we're happy to be here as long as you need us to be. I wanted to really start with the end, to focus on the four main themes of today's webinar, what we really want you to walk away remembering about domestic violence in New York State and what it really means for New Yorkers who are experiencing domestic violence along with their family members. So what we really want to press upon you, number one, is how high the demand is for domestic violence services in New York State. We've got the highest demand for services in the country. That's consistent year over year. And probably more important is the number of individuals who are looking for domestic violence services that can't be met. And that's really a failure of our system. And we're going to be talking about that in a little bit deeper in a few moments. The next thing I'd like you to remember after today's webinar is that requests for domestic violence services increased during the pandemic in those first months. You probably heard about that. But since then, now nearly 2 years into the pandemic, the increased level of demand has continued, and we don't see any signal that it will decline anytime soon. But despite these increased demands on advocates throughout New York State, funding to domestic violence programs is actually being cut. And funding for all crime victims services is being cut in this year's state budget. So I want to walk you through all of that detail and ask for your assistance in helping us get more funding for crime victim services in New York. And lastly, I'd like to walk through a path for New York to follow to really fix our broken system, not only in the manner of funding domestic violence survivors, but supporting them. Our system needs to be more innovative, more survivor-centered, trauma-informed. And Niskativ, along with domestic violence advocates across the state, have identified a path for the governor and legislature to take to move us in that direction. So before I talk about these four principles in a little more detail, I just wanted to introduce Niskativ to you, to those of you who might not be familiar with our organization. Niskativ was established more than 40 years ago. We are designated by the federal government as the Domestic Violence Information Clearinghouse and Resource Center for New York State. Every state in the country has a domestic violence coalition like Niskativ. And our roles and responsibilities range quite a bit, but we really have two sides of the work that we do. One is on policy development and systems change work, and we do that work both on the state and federal levels. And then we provide a lot of support, education, training, and technical assistance for domestic violence service providers throughout New York State, whether it's the program leadership or new employees or anyone in between. We provide training and education and peer-to-peer support so best practices and innovations can be implemented statewide. And throughout all the work that we do, we have an equity and inclusion lens. So while identifying our priorities, certainly legislatively and from the policy side, we do it with that intersectional lens because we know there are so many issues that impact domestic violence survivors in New York, whether it's criminal justice reform or how our criminal justice system functions, same with correction systems, our healthcare systems, housing. So all of these issues really contribute to the experiences of individuals experiencing domestic violence in New York and are a concern for us here at Niskativ. Now, for those of you working in Albany, you might recall seeing us in vast numbers in the well of the Capitol during one of our 2 annual advocacy days during the year. Our budget advocacy day is happening right now. Actually, the formal day is February 15th. But in this virtual environment, we're able to meet with legislators. Maybe we've already met with your office to talk about our budget requests for this year. And then we have another advocacy day in the April-May timeframe, usually in the well of the LOB, where you might see us with our purple scarves on. Unfortunately, that event's been virtual. Hopefully we'll be in person in Albany this year. We'll have to wait and see. But that's a great opportunity for legislative leaders to come speak to us about their commitment to domestic violence. Governor Hochul has spoken with our group in the past, certainly Senator Krueger and Assemblywoman Weinstein and others. So we look forward to seeing you then, if not before. I'd also like to just briefly talk about what we mean when we say domestic violence. There's a lot of definitions out there for what domestic violence is, and they vary here and there. But I think what I really want to impress upon you about domestic violence is it's not a one-time event. This is a systematic pattern of behavior that involves power and control. So one party controlling, using power to control another party in the relationship. And while it can include physical violence, it doesn't always include physical violence. It can include sexual violence, threats, economic abuse, technological abuse, and all of these different tactics contribute to an individual's well-being, and it could cause physical injury, it could cause psychological trauma, it could even result in death for the individual experiencing domestic violence or a family member. So it's very dangerous, and it's very prevalent in our community. It affects all people, regardless of age, socioeconomic status, sexual orientation, gender identity, race, religion, nationality. We don't see any specific trends in any particular community or demographic. It really cuts across everyone. Now, to give you some statistics, just to give you some foundational information, on average, more than 10 million people a year are physically abused by an intimate partner. And we gave you the citations there at the bottom of the slide. And as Jennifer said, you will be getting these slides so you can see the data for that. But 1 in 4 women and 1 in 9 men experience severe sexual violence, physical violence, or stalking by an intimate partner during their lifetime. And we're now seeing some research specifically targeted to the transgender community. And what we're seeing in those studies is pretty troubling, that 30 to 50% of transgender individuals report that same involvement with domestic violence. So something, we've been talking a lot about as a community, but important for you all to know. And all of this translates into some significant costs, not just in New York, but across our whole country. According to one study, the cost of intimate partner violence exceeds $8.3 billion per year. And think of the impact to businesses on that. We know that 8 million days of paid work are lost each year from individuals experiencing domestic violence. So tremendous impact to our businesses, to our systems, to how we function as a society because of domestic violence. So what does it look like in New York State? The numbers are a little bit higher, which is going to lead us to maybe another fact I want you to walk away remembering. But in New York, we have about 32% of women and 29% of men who experience intimate partner physical violence, sexual violence, or stalking in their lifetimes. Now, the data that we've been able to gather with statistics in New York State is a little dated. I think we've had some delays in getting data reported to us because of the pandemic. But when you look at the last data we have from 2019, the statistics are pretty troubling. We had a 10% increase from the year before in the number of intimate partner homicides, 65 in 1 year. And we had more than 237,000 orders of protection entered into our state registry for those orders. According to our Division of Criminal Justice Services, DCJS, in 2020, more than 55,000 intimate partner victims were reported. So a lot of, obviously domestic violence is impacting thousands of New Yorkers each and every year. So like I said, that leads us back to our first fact that I'd like you to remember after today's webinar, which is that New York has the highest demand of domestic violence services in the country. And we know that, excuse me, from a national survey that is conducted each year by our umbrella organization, the National Network to End Domestic Violence. And each year, usually in the fall, they go out on one specific day and they connect with domestic violence programs all across the country to research the services provided to domestic violence survivors and the number of services provided to those clients. And that's where we know that New York has the highest demand for services each year. In 2020 alone, on that one day in September, we had more than 8,300 individuals getting services across the state. That's more than 2,500 victims from the year before. Now, obviously, 2019, we were not in the midst of a pandemic, and in 2020, we were. So think about the impacts of the pandemic on all those individuals experiencing domestic violence in New York. Now, in that same survey, we were able to identify that nearly 2,000 people, in addition to the 8,300, asked for services that they could not receive. And that's for a number of reasons. Maybe there weren't resources available. Maybe there wasn't a staff person available to assist them because of an open job position. Maybe it was a funding concern. But for a large number of individuals who are seeking services in New York, our system is failing them because we are not able to provide the services that they're looking for. And these services in New York, we sort of divide them up between residential services and non-residential services. So residential services are emergency shelter, safe homes, transitional housing, whatever housing needs the individual might need. But then there's a wide array of non-residential services that domestic violence advocates provide. Information and referral to other community-based organizations, general advocacy with community services, counseling services, legal advocacy, job training and assistance, work with children and children's support, as well as support groups for the survivors themselves. So what we saw during the pandemic is that the need for these services tremendously increased. I think the last statistic I saw coming out of New York State was a 42% increase in the calls to the statewide hotline. And we also know that programs report similar increases to their local hotlines as well. All individuals in New York experiencing domestic violence seeking services and help. But what I really want to leave you with today is that this isn't just a split moment in time. We're now 2 years into the pandemic, and we don't see any signal at all that this heightened level of demand for domestic violence services that began in the initial months of the pandemic will abate anytime soon. The increasing demand has continued for nearly 2 years. We know this from a number of surveys that Niskativ has done with domestic violence programs across the state. Our last survey was done just about a year ago in March 2021. We'll probably soon do another one. But in the for all of the programs that responded to that survey, 60% reported an increase in service requests. Now remember, this is a year after the start of the pandemic, March 2021. And we also hear from 68% of those programs that not only is the demand increasing, but the level of violence and the complexity of the requests for assistance also is increased. And the reason why that's important is because if there's a higher degree of violence associated with a particular situation, or if it's more complicated, that means it takes more time and resources for the advocacy community to respond, to get that individual the services they need. So a lot of pressure right now on advocates to fulfill the demand and the requests for help. At the same time, we've seen a reduction in occupancy rates in our emergency shelters, which probably isn't a surprise during a public health emergency like COVID, where people might be concerned about their health and safety entering a congregate care setting. But the reason why this is troubling in New York State is because the way that we fund domestic violence programs is directly tied to the number of survivors in shelter on any given night, what's referred to as a bed night. So a program that's providing residential services to domestic violence survivors will get reimbursed by New York State based on a per diem set by OCFS for every night that a survivor is in that bed. And we're going to talk a little bit more about the challenges of this per diem reimbursement model a little bit later. But I just wanted to give you that little nugget of information that during the pandemic, shelter occupancy rates have decreased in some communities pretty significantly. So getting back to our survey, the kinds of things that we heard about the needs of survivors is that, obviously, like I said, services have increased. Advocates are feeling overwhelmed. There's an increase in requests for mental health services. And what we're hearing is it's very difficult to meet that demand for mental health assistance. And we also know, like I said, that those who are entering shelter, one advocate said that they're experiencing significantly more violent incidents. And another advocate said they're concerned about lethality, serious strangulation, several stabbings happening. So we know that this is happening throughout New York State. More lethality factors, more dangerous situations, increased risk for survivors. And the other thing that sort of elevated during our survey from March was the housing difficulties, which probably isn't a surprise. We already have a crisis on our hands with respect to the amount of affordable and safe housing for all New Yorkers, but particularly domestic violence survivors. It's very difficult to find housing for a survivor and their family who is in emergency shelter, so that they don't have to return to a community where their abuser might be located. So there's a lot of difficulty finding housing. And, in the pandemic, certainly a lot of people decided not to leave wherever they were. So the housing market really just, came to a standstill. People weren't moving around. So housing is a really difficult issue for survivors and something that, is a priority for us at Niskativ, as well as domestic violence advocates throughout the state. Now, the third takeaway I'd like you to remember is that despite this increased level of demand for domestic violence services in New York State, despite having the highest demand for domestic violence services in the country, funding for these services is being cut. And the cuts to victim services aren't limited to domestic violence. It actually is impacting all services that assist victims in New York. So I'd like to give you a little more information about that because of its very serious nature and significant impact to providers. You might be familiar with a funding stream that comes to New York from the federal government called the VOCA funding. VOCA stands for Victims of Crime Act funding. So the VOCA fund is a grant that comes to all states. It's funded by the federal government. And what we've seen over the last several years is significant declines in the amount of those federal grants going out to states. So this situation is not unique to New York. All funding for VOCA was cut to all states in the country. But the impact in New York State is pretty significant because we had a large VOCA grant. We're a pretty populous state. So in the last 4 years, from 2018 to 2021, our VOCA grant has decreased $140 million. So it used to be about $200 million back in 2018. And last year, it was just $60 million. Obviously, we can't do as much with $60 million as we could with $200 million. So as a result of these decreasing federal funds, we've heard from the Office of Victim Services, OVS, which administers VOCA dollars in New York State, that victim assistance providers all across the state are going to be cut pretty significantly when OVS issues its next awards, their 3-year awards, later this year. So this is going to have a very significant impact on programs and services for all victims of in New York. And I want to be really clear when I say all victims, this is not limited to domestic violence survivors. Certainly domestic violence survivors are included, but it also includes victims of sexual violence, child sexual abuse, all homicide, vehicular accidents, robbery, any kind of crime where a victim would turn to a service provider for help and assistance. It's very likely that that service provider is receiving VOCA support. So all of that funding is endangered. So how can we, what specifically is the impact? Well, we know that victim assistance providers have been told to expect 10 to 15% of their funding to be cut. And OVS has already canceled existing contracts with legal service providers for the 5th year of existing contracts. Now that alone, that 1 year of the legal services for victims, and these are civil legal services, I'd like to point out, is $16.7 million. So we believe these announcements of the cuts in the next round of awards, as well as the cancellation of existing contracts with legal service providers, is already causing service delivery in New York State to be impacted. We know that programs have decided not to fill job openings because they're not sure they're going to have funding for those employees down the road. And we know that legal service providers are not willing to take on new clients because they're ethically bound to ensure that they can work with that client for the duration of their case. And since these cuts are going to be implemented in the fall, there's a very high likelihood that the legal service provider, the attorney, would not be able to work with that client because they're no longer going to be funded. So to give you a sense of the impact in the Hudson Valley, one program has 20 VOCA funded attorneys, and they're looking at not filling 5 of those open positions right now because of these impending cuts. In Monroe County, out in Rochester, we've identified 90 individuals, domestic violence and other crime victims, who need civil legal support, who cannot be paired up with an attorney because of these impending cuts. So these announcements of impending cuts are already causing a lot of concern and angst enough that it's impacting the delivery of services for crime victims throughout New York. Now, of course, when these cuts are implemented, which will be as of October 1st, we know that there will be many more implications for programs. It's very likely that some programs might not be able to sustain the cuts in funding, because I think I failed to mention earlier, VOCA is really the primary funding source for many of these providers. A majority of funding, meaning 60–70% of the program funding, comes from VOCA. So if VOCA is cut, that means a significant impact to those programs. Now, Congress at the federal level has made some changes to the way federal funding gets earmarked for VOCA grants. That happened last summer. It was a new law signed into effect by President Biden, and it was called the Voca Fix legislation. And we were thrilled that Congress and President Biden saw the need for these essential services and took these measures to get the VOCA grants trending in the opposite direction, moving, increasing over the years. But we also understand it's going to take a little bit of time for there to be enough at the federal level restored so that the VOCA grants to states can increase. It's been predicted to take maybe 2 to 3 years. So a relatively short term before we can see increasing VOCA grants into New York. Many other states have taken proactive measures to ensure the continuity of victim services in this interim period, this 2 to 3 year period. To give you an idea, we know Texas has set aside $160 million. California has set aside $100 million. Alaska, West Virginia, Missouri, other states have set aside a combination or one or the other of either state revenues or pandemic relief funding, some ARPA funding, to ensure that their state crime victim services are maintained until the VOCA grants begin to increase again. New York has taken no such step, and we urge the governor and the legislature to earmark dedicated funding to maintain current levels of funding. We believe it's about $25 million a year needed to do that. And the state is really well positioned. As we've all read in the paper, there's a vast state surplus. We're in a terrific position with respect to that. And we have billions of dollars of pandemic relief aid. So, we're turning to you all as legislators, as legislative staff, as well as the governor's office to take the important step to stand with survivors, to make sure that crime victims get the services they need, particularly when we hear about increasing crime, across many, many communities. And the other thing I'd like to point out is that $25 million is just a small sliver of the governor's proposed $216 billion budget. It represents 0.01% of that budget. Now, I want to give you a sense for the context of these cuts, specifically for domestic violence programs. As I said, there's VOCA coming in from the federal government, but we also receive additional funding from the federal government to support domestic violence services. And each of these federal funding streams are administered by different state agencies. So particular to domestic violence service provision in New York State, we deal with so many state agencies on so many different contracts. I'm really not sure of another service industry that has this kind of level of regulation and bureaucracy to contend with. So what I did here on this chart is to identify the primary federal funding streams that New York uses to support domestic violence services. And then on the right side, the agency that administers them. So we already discussed the VOCA funding, and that's administered by OVS. But what I want you to take away from this is all the O's. There's OCFS, OVS, OTDA, OPDV, DCJS, okay, that's a D, as well as the county DSSs, which aren't on this slide. But a lot of this funding actually flows from the federal coffers into New York State, to the state agencies, out to the county departments of social services, and then out to domestic violence programs. This is such a complicated system. There's so many moving parts to it. There's multiple contracts, each with their own contract terms, durations, terms of service, reporting requirements. It's just it's overreach and overregulation by New York State on domestic violence providers who have not gotten into this work to become paper pushers. The people who do this work get into this line of work because they want to help people. And this prevents us from doing that. The other item I'd like you to keep in mind when you think about the context of the funding and the impacts it has on domestic violence providers is this very antiquated system that we have, which was developed more than 30 years ago when states were first putting together an infrastructure to respond to domestic violence services. So the system was structured to prioritize shelter because at the time, back in the 70s and 80s, most domestic violence survivors were seeking emergency shelter. So it made a lot of sense at the time. Today, however, we have just as many survivors interested in receiving non-residential services as residential services. So bringing you back to the results of the nationwide survey done in 2020, of those 8,300 or so individuals who received services in 2020 on that one day, it was about evenly split between those seeking residential services and those asking for non-residential services. So it's time for our system to be changed so that funding isn't prioritized for the residential services over the other essential services survivors are seeking. The other challenges of our per diem system is that the programs only get paid when survivors are actually in shelter, which is referred to as a bed night. So when a shelter has an open bed, that program does not receive funding based on that bed, even though the program is required to have that facility fully staffed, fully maintained, food in the refrigerator, all services available should survivors come to the shelter. So the programs have to expend the same cost, regardless of whether there's one individual in that shelter or 20 in the shelter, but yet they're only paid when survivors are there in the shelter on any given night. It also precludes a program from being truly survivor-centered and holding a bed for a survivor or a family member who has to temporarily leave shelter. Maybe it's for a court proceeding that's in another community. Maybe it's for a child who is ordered by the court to attend a visitation with the other parent. There are loads of reasons why a survivor or a family member would temporarily leave shelter. But again, when a program chooses to hold that bed, they don't get funded by New York State to hold the bed open for that survivor. A big challenge for programs. And there's a great administrative burden that's attached to this system that we have for funding domestic violence programs in New York State. We could certainly get deeper and I can answer a lot of questions about these administrative burdens, but because the counties are responsible for covering the reimbursement fee of the bed nights, they can get into disputes with one another, particularly if a survivor lives in one county, but then moves into another county to obtain shelter. And as the counties sort of, work through these issues and questions of who is fiscally responsible for the survivor's stay in shelter, the program remains unpaid. And this can go on for months months beyond the typical 3 or 4 months it takes to get reimbursed when everyone agrees who's fiscally responsible. So these kinds of issues make it very, very difficult for a program to be able to predict what their revenue will be coming in any given month and when they're actually going to get the money in hand. So think about running a business when you really have no confirmation of what your revenue is going to be and when you're actually going to receive that revenue. Now, like I said at the top of our webinar, Niskativ and domestic violence advocates have been talking and visioning about a path forward for the governor and the legislature to take that would truly innovate our system and make it survivor-centered and trauma-informed. And while I'm not going to go into every detail of that plan, I'd like to just highlight a few specific actions I think the legislature could take, particularly in the short term, to really improve situations for survivors across the state. The first, of course, is dedicating specific funding, dedicated funding to make up for the VOCA shortfall. So we believe that $25 million is needed to maintain current funding among those who have existing contracts with OVS. This is not asking for more money. This is merely to keep programs whole so they don't have to experience the significant cuts that OVS is warning us about. Now, we know again that the state has the money to do this. It's not a lot of money when you compare it to the overall value of the budget. And we're urging the legislature to support our request here. And one other question, because I have gotten some concern from legislators regarding, doing something like this on the short term. How can we be sure that this is going to be rectified in 2 or 3 years, or will this now become a long-term need? As I mentioned, the Voca Fix at the federal level was signed into law over the summer. In the last 4 months of 2021, we saw significant deposits going into the Crime Victims Fund, which fuels the VOCA grants in that period of time. $350 million, in fact, in those 4 months, which is significantly higher than any of the deposits in the months preceding that period. So we're optimistic that the changes Congress have already made will realize these increases in VOCA grants down the road, and then New York State would be able to rely on that federal funding just like it has in years past. So a short period of time, $25 million a year in order to maintain funding for crime victims statewide. Some additional actions we're asking the legislature to take. We do get a set aside in the Temporary Assistance for Needy Families Fund for non-residential domestic violence services. The number has really revolved around $3 million since it was first proposed more than 20 years ago in the year 2000. Last year, we had a very slight bump in the number that was set aside, which is always appreciated. So it was actually set at 3.2 million last year. Unfortunately, the executive budget returns this set aside to $3 million. And just something I want to point out, if this fund was keeping pace with inflation, it would now be at $4.6 million. It never accounted for the increased demand for non-residential services that I already talked about. So because of the inflation issue and because of the increased heightened demand, we're asking the legislature to please increase this set aside from $3 million to $6 million. And that might sound familiar to you because we have been asking for this increase for many years. I really believe 2022 is the year we can make this happen. Finally, there is a line item in the budget of OCFS for a pilot project to look at New York State's model for funding domestic violence services and pilot a new, more innovative model to see what would be most successful so then we could advance that statewide. The last two budgets included some appropriations for the performance of this pilot. We are fully behind it. We're hoping to collaborate with OCFS when it's conducted. And there's an additional $5 million set in this year's executive budget for that pilot program. So we're asking the legislature to maintain that $5 million as well as the $10 million in the reapprops so that we can get that pilot off the ground. Now, one other thing in the budget I'd like to mention before I move on to see if there's any questions is an item that appears in the Article 7s, which is in the Public Protection and General Government budget, the PPGG budget. It's Part H, and it relates to a new mandate that would require all domestic violence advocates to complete 40 hours of training that would be developed by the state at the Office for the Prevention of Domestic Violence, OPDV. And OPDV would develop the training and offer the training. Now, we have some concerns about this proposal. First off, we unfortunately didn't have an opportunity to collaborate with New York State in the development of this proposal. We saw it when the legislature saw it, when it appeared in the executive budget, which is disappointing. We do think that there is merit to discussing enhanced training for domestic violence advocates across the state, and possibly even a certification program. But we don't believe now is the time for new mandates on domestic violence service providers. And we also don't think that training should be the responsibility of a state agency. Niskativ has a very significant role in training and providing technical assistance for service providers. We'd like to see that continue. But there are other issues related to the proposal that we have significant questions about. There are new definitions in the proposal that don't align with current statutory definitions. The proposal does not modify the role of OCFS in licensing and approving domestic violence programs. So if this proposal was approved, domestic violence programs would be licensed by OCFS, but their staff would be trained and certified by OPDV. This does not simplify the regulation of domestic violence service providers. It also includes the Department of Health in the list of agencies that would now be responsible for rules and regulations pertaining to domestic violence programs. So remember the slide I showed you where there were numerous state agencies already responsible for funding and oversight of domestic violence programs. This now would add a sixth, Department of Health. So it's not really moving us in the right direction of simplifying the regulation of domestic violence programs. It actually makes it more complicated. It also doesn't modify the current regulations that we have from OCFS for training. So OCFS already has training requirements in our regs, but this proposal doesn't address those current requirements. So we have a lot of questions, some concerns about the proposal, and we're asking the legislature to remove this Part H from the PPGG budget so we can have more time to work with the state to refine the proposal and come up with something that would really work for domestic violence advocates in the field, because we all want to support them and make it less burdensome for them to bring on new staff and get them trained up and onboarded. So I know I've spent a lot of time talking. I haven't even looked at the chat. So Brittany, can you help me if there's anything in the chat I need to address?
Hi, Joan, nothing in the chat.
Oh, nothing in the chat.
If folks have questions, please feel free to drop them in the chat. If you'd rather share them anonymously, you can submit them directly to me or to Joan. But please feel free to ask any questions.
And there are no silly questions, of course. I'd also like to include here my email. So if anyone is interested in reaching out after today's webinar, please feel free to do so. Brittany and I are here. We can hopefully get your questions answered. We can, match you up with domestic violence advocates within your districts. If you haven't had an opportunity to meet your local program and advocates, we're happy to arrange that. They are your constituents, and I know legislators are always interested in meeting with the individuals who are working and providing services in their districts. So if that's of interest, please let us know. So we'll keep this open another minute or so, but I'd like to close today's webinar, say thank you to everyone here who has participated, and we will distribute the recording of today's webinar along with the slides as soon as they're available.
Joan, we do have a question. Are there current certifications needed for DV service providers? And the PPGG budget adds another layer.
Yes, there is no current certification in New York State for domestic violence advocates. I do want to note that there is a training requirement and certification for rape crisis counselors. So there is a little bit of a difference for rape crisis counselors versus domestic violence advocates. And I believe this proposal, one of the objectives was to bring some similarity to the requirements for rape crisis counselors and domestic violence advocates, because many programs serve as dual programs, providing services to both sexual violence survivors as well as domestic violence survivors. But currently there is no certification process for domestic violence advocates. And I do think that this proposal in the PPGG budget would create a new layer of bureaucracy, because for the domestic violence advocates, now it would involve OPDV working with OCFS, OVS, and DOH in the creation of the rules and regulations pertaining to training. And Department of Health right now has no responsibility for overseeing domestic violence programs or their staff. I hope that answers that question. Okay, well, with that, thank you very much, and we'll be seeing you soon.